Hi everyone, this is my video for the theory-guided nursing practice. So the first question asks, why do we use theories in clinical practice? And my answer to this is that theories are going to help guide our evidence-based research, which then will lead to the implementation of practice and policies. These policies are going to be procedures that help keep our patients safe, while they also provide the best care possible to the patient. So it will help us to provide ultimately the best care to the patient. And I think ultimately that's why we would use a theory in clinical practice. The second question asks, does theory use make a difference in care? And I think, yeah, based on my answer to the first question, obviously we want to give the best care possible to our patient. So using a theory allows us to understand how different aspects of health and illness affect one another, and we have to understand the connections between health and illness, and then be able to provide appropriate treatment plans to our patients. So using a theory will help us do that. So ultimately, to answer the question, yes, I think it definitely makes a huge difference. Otherwise, why would we use it? How would you know if a nurse was using a theory to support working with a patient? This one kind of tripped me up for a little bit because I think I was thinking too literally about it. I think I was thinking more, how would I know if a nurse is using a specific theory? But to broaden it up, I think the theory itself provides a framework that guides us as nurses in our assessments, our planning, and how we evaluate our patient, viewing them as a whole person that interacts with the environment, I think is one of the biggest way that I would know if a nurse is using a theory while working with a patient. But more specifically, I think something like Florence Nightingale's theory of caring, if the nurse was modifying the environment to match the patient's needs, I think that would be one of the easiest ways to tell. Or just, simply asking the nurse, hey, are you using a theory in your care? But also I thought, in general, there's 3 different theories of nursing. So there's the grand nursing, the middle range, and the practice level nursing. That one I think I was thinking a little bit too far into. But ultimately it allows us to implement care with purpose and proactively. So that would be, I think, how I would tell. What would you notice if a nurse was not using a theory to support working with a patient? Sorry, my cat's acting up. I think one of the first things I would notice would be a large disconnect between the patient and what the goals of the nurse would be. So if the goal of the nurse is to get the patient out of bed, but the patient is in a severe amount of pain or there's clutter around on the floor, I think noticing a large disconnect would be one of the first things you would notice. So I guess the goal and the plan of the nurse would not align with the patient's needs or wants. And it might actually lead to poorer health outcomes for the patient. And the last question, how could theory use in a clinical setting impact nursing quality, safety, indicators, and patient outcomes? I think to enhance practice directly, it would stimulate practice-based thinking by using the tool of reflection, or indirectly in further developing a theory. So I think in a clinical setting, it would improve safety to use theories, and ultimately using the theories to improve safety will improve patient outcomes. So depending on which theory you're using, will be, I guess, up to the nurse to choose which one is applicable in each setting, and that will ultimately improve patient outcomes.